I'd like to welcome you to the session Digital Care, How Care Will Look in the Near Future. There are not so many people. Maybe it's because the day was long and you're quite exhausted. It could also be that care or elderly care is not this sexy topic the people are expecting. And I'm wondering why elderly care is not so important as it is for the society. My name is Florian Caspari, and I want to introduce you to Diana Heinrichs, CEO of Lindera, Giuseppe Conti, CTO of Nively, and Tim Kahrmann, CEO of Pflegix. I would like you to introduce yourself and then give us a small glance into your company, what your company is doing. Diana, would you like to start?
Yeah, thank you. Okay. Hi, my name is Diana. I'm coming from Lindera. We have developed a mobility test to prevent seniors from falling. That might sound random or ridiculous to you at the first place. Falling is the second largest cause of accidental injury and death. So that's what really brings seniors to an end. It's staggeringly expensive for an insurance system. It costs as much as diabetes. And still the whole field hasn't seen any initiatives, any digital innovations, because it was quite hard to do geriatric assessments, so the analysis of the gait for seniors in a very simple way. You need at least 3 cameras or an Xbox Kinect to trace the human being over space and time, so his movements, what we can do with our eyes. And we found an AI-based solution, so artificial intelligence solutions, to do it with a simple smartphone cameras. You just do a video of a working person, and then we can do the medical assessment. That's what we do.
Okay, thank you. Could you please add something? What is your business model? Who is paying for the service you're offering?
For sure. We have got everybody in care is quite sure that this geriatric assessment, this gait analysis, are of value. So the caregiver thinks so, the insurance companies think so, kind of everyone. But due to a lack of time, they can't do it regularly. Due to lack of language skills, it's really hard to do the whole assessment and to type it. And for us, so the insurance company is paying. So we are working together with Germany's biggest insurance companies. Our medical partner is Charité in Berlin. And we are working together with Germany's biggest charities who are providing the care and who want to really get onto a next level in terms of quality standards, in terms of supporting caregivers without controlling them. It's always about connecting people instead of controlling them through cameras, through sensors, but really do assessments in a connective way.
Okay, so the health insurances are paying for your service, and the digital service you're offering, is this for professional caregivers, or is it for the people in need, or for the beloved ones?
Actually, for anyone. So we have got cases in where we do it in a nursing home, meaning that professional caregivers can do it, but also non-professional caregivers can support them, and it's still the same quality standard. But we also have got a lot of inquiries and projects with ambulatory care services. Sometimes there are professional caregivers in this ambulant environment, and sometimes it's only the family is caring. So in all 3 cases, it simply works. So our software, our app is so simple. It take a video of the movement and answer some question of the mental well-being, and that's all. And the whole calculation, it's what we're doing in the back, so everybody can use it.
And you're on the German market or already international?
It depends whether you say Austria is international or not. Yes, so that's up to you. And then, step by step, we go beyond Germany. But now we are training our algorithm together with Charité, together with the charities in Germany and an insurance company. And then, step by step, it's easy to go board because it's very easy to translate the language into another or to translate it into another language. But it's another step to really get into an insurance system. The NHS in the UK, for example, it's transforming itself. So I think it's quite a challenge to find the right point of entry.
Thanks a lot. Giuseppe Conti, would you like to introduce yourself?
Yes, thank you. I'm Giuseppe Conti from Nively. We are based in Nice, in France. We have developed Mentorage, a solution for monitoring people, so it's somehow a similar scenario. We monitor elderly people at home or in institutional residences, and what we do, we analyze their body movement through a 3D sensor. We don't use cameras as a choice, and whenever a condition of possible danger develops, such as the person that is about to fall or night wandering and so on, then we fire an alert to the caregivers, be these the relatives or the professional caregivers.
Okay, so did I get it right that you're offering a service mainly for the professionals or also for people who care for their loved ones?
That's correct. Right now our market is the B2B market of nursing homes. These are our biggest customers. We have two exceptions. One is a day center for children with autism that shares similar range of problems. And another one is an hospital with very complex psychiatric issues, where again the dimension of assessing the movement of the person becomes important.
Okay, and maybe some words about your business model?
Right now we sell the solution as a full package, so we license it or we go for a service with a startup fee in the B2B. And over the next few months, within let's say half of next year, we will be moving also to the B2B2C, which is at-home service. So we are developing, the product is ready, we are testing it in a number of pilots. We are now developing the distribution chain and so on, and in that case it will be service.
Great, thank you. Tim Kahrmann from Pflegix, I already can see your shirt. Would you like to introduce yourself?
Sure, thank you so much. My name is Tim. I'm one of the 3 founders of Pflegix. We are basically 1-year-old startups. We are creating a digital marketplace for care, which helps to connect care-seeking families or individuals with caretakers. And the caretakers can either be professional or unprofessional. And this is basically the B2C side of our marketplace, and we are slowly moving also towards the B2B towards the B2B marketplace, where we are also enabling businesses or organizations which are in the same sector to use our marketplace to address the same target audience that we have, basically the families or individuals that are in need of care.
Okay, do you offer more services than connecting to caregivers?
Could you repeat the question?
Sorry, do you offer more services than connecting to caregivers? So.
Well, the B2C model is basically that we are connecting the two sides, the caretakers and the care-seeking families. And the caretakers provide a whole range of different services. That's one part of our marketplace. But then on the other hand side, in the B2B sector, we have a lot of businesses or organizations who provide different services than we do, or extend our, for example, also producers of smartwatches, for example, for elders that want to use our marketplace to distribute their products, are able to use us as a marketing platform.
Okay, so if my mom is getting sick, then I can find a nurse or somebody who is caring for my mom.
Exactly.
Okay, who is paying for that service?
We are at the moment addressing the families that will pay for themselves. So they, in terms of our business model, we are working with the membership models. The families need a membership in order to be able to contact the caretakers on our platform, and we also do the hourly documentation and the billing. We will send once a month a bill to the families or the individuals that are receiving the services, and they will pay for themselves, or in the case of the so-called Ersatzpflege, Veränderungspflege, the insurance will pay a part.
Okay, so one of the big challenges in the healthcare system is to find professional staff. Can your solution solve this problem?
Well, we hear this a lot from the entire market, basically, but we can't complain. We have more than 1/4 of the caretakers in our platform are professionals. So we, on our end, don't really feel that need. That's also why we look into different other areas of using our marketplace to solve various problems of the market, and one being the staffing issue.
Okay, thanks a lot. As we have heard, 3 quite different services. One is more hardware related, I would say. The other one is a marketplace, and then AI service. Is that correct? Can you tell me some more examples of digital solutions, let's say best practice cases or services you have seen, or you would say this is a very good service to improve care for elderly people?
Well, I can't think of one particular service or product, but I would say in general, this, as you mentioned it in the beginning, this market is moving very slowly in Germany. And I think if we look internationally, especially towards the United States, people are much more open towards experimenting with different solutions. And that's how we basically started. We just said we just start and we try to test our hypothesis whether for example, there are enough informal caregivers out there that are willing to offer their services to elders, etc. So, generally speaking, I would say, if you look internationally, more companies are willing to experiment in different fields, and also are able to get funding easier than it is in Germany, and that makes it easier for them to experiment in different fields.
Diana, can you tell me about some digital service which is not in this panel, in the field of elderly care, where you would say, well, this should have been my idea, this is a great stuff?
So I'm a huge fan of the Aging 2.0 newsletter. So where kind of every week I take a lot of ideas for myself, and I've got defined 3 criteria for myself what I'm looking for. So first one, the most important one, was really easy to use. So easy that everyone at every age can use it. Second thing is what's in terms of design. So when we talk about elder care, everybody has got kind of some gray pictures, uninspired room in mind. So at least from what I would say, and where we can really find something that makes fun or a colorful life, really a life worth living. And the second thing is, of course, the price point. So what's accessible in terms of, or affordable in terms of pricing. And there in the US, we see a lot of smart home things. Here in Germany, one thing that I got through was a tablet. that's really totally nice in terms of design, called Nepos. And it's really an iPad for seniors. So from a UX, you always have got the same logic within an app. So not that you have got one app starts here and the other one has its button there. And from a hardware perspective, it's really nicely designed. If I remember rightly, with a really famous designer from B. Brown. And there I see really something going forward, bringing pricing, design, and also in a very simple way come across.
Yeah, thank you. So simplicity is a very big issue if you want to produce services for elderly care. Giuseppe Conti, your service is more, I would say, in the field of AAL. So it should be part of an ecosystem, as I would say it. Which other hardware devices would add value to your service?
Well, right now we certainly qualify as AAL, so it's the typical scenario of try and make the environment as intelligent as you can, essentially. And I totally buy your motto that usability must be pretty damn simple as possible. In fact, our idea is that you don't even have the interface, but it's the environment itself that becomes reactive. So that's item number one. Then, of course, the challenge there is to, and everybody knows it, this is no secret, is to try and keep people at home as long as possible. Then the model, essentially, this is where everybody in the AAL, or most of the companies in the AAL are trying to move, is to try and create a kind of distributed nursing home. So trying to provide the same spectrum of services that a nursing home would provide at home. Of course, there is a problem because you are stepping from a medical to non-medical technology. So in between, there is a kind of a blurry edge between what is well-being and what is healthcare and clinical. So, and this is probably one of the issues that we might address in the discussion later on. But certainly, the intelligence of the environment needs to be coupled with the monitoring of elderly people. This is something that goes by itself because usually there is a problem of making sure that they are healthy. So in example of a project that we are carrying on with the IT Digital, we have integrated consumer grade, not clinical grade, consumer grade devices to essentially monitor the level of healthcare of the senior. We are talking about pulse oximeter, about heartbeat measurement, pressure monitor, in a way that it becomes a good habit, a constant habit that the person by themselves can measure they can be empowered and become more aware. So that's the other bit of hardware. So it's the medical devices. And then you have the IoT. The IoT means all the sort of smart devices that you can plug it into your home. My fear is that we are creating a monster. It's in one of the pilots that we are running now. This is a true story. This elderly volunteered to install anything she could possibly imagine. So she's living now in an apartment that is full of all sorts of technologies, from smart lamps to smart anything, and it's too much. It's just too much. So it's impossible for her to manage. She tries to turn on the TV with a smartphone. I think now this tendency towards smart environment is drifting us to a stack overflow of technology. So again, usability, user-centered design with seniors, these are the keys. So back to simplicity, that would be my motto.
In which fields do you think digital services can improve the quality of life of these target groups? So if you say too much services is too much, and IoT is not the solution to improve home care, where do you see the future?
I think the most important dimension are the ethical dimension and the dignity dimension. The difference with the caring domain, which is not cure, but it's care, is that we are talking about people who might be independent or partially independent, or totally independent for that matter, that at some point might need some help. This is obvious, this is natural to some extent. The point is to empower the person to a way that they can do things by their own without the sense of stigmatization that comes with some of the technology. So in my view, if we are talking about autonomous people, what is called activity of daily living, so make sure that you can do whatever you normally do in a normal way, so technology that can help you in the daily life, but again, which are not stigmatizing. This is the key. Then if we move to partially dependent or completely dependent, then thing changes, unfortunately, as we know.
So independence and empowerment are very important in the field of care. Diana, in which fields do you see that digital services can improve home care? Where do you think is the future that people can stay longer at home?
So to my mind, the first thing is really ethics. So, I mean, we have to really draw a clear line. Do we really want to, or no, I personally, I'm totally sure we don't want to replace human interactions and emotions and all that stuff. So I don't think that we should put technology at that end. But when when we look back in the 1970s, we all lived with our different generation under one roof. Yeah, I'm growing up in a multi-generation home. So then we saw over the next decades more and more working women. We had separate family structures, patchwork families. We had got Erasmus, we took it all aboard, yeah. And now we are back here in 2017, and what we all want, what we all really, really want is family. And how can what kind of digital solution, technological solution it is, how can this support us? So to have got this feeling again that we are connected and as briefed, as wise as we would live under one roof, that there's an exchange between the doctor, between the caregiver, between the family, because all these people have got a lot of knowledge, and how we can really enhance this exchange of wisdom between them on a constant basis. And there I think technology can do still a lot, but still we have got to draw a very, very clear line when it comes to emotions and really human interaction, and at the same time when it comes to surveillance and control.
This is a very good point. I think that digital solutions never or can never replace human relationships. But there are a lot of solutions like robots, for example, in the field of dementia. What do you think about these kind of solutions, Tim?
I think we will definitely see robots in this field in the long-term future. But near-term we need to overcome the different hurdles that start with the streamlining of the administration and different processes that are needed in order to synchronize the caretaking. In this field, as Diana mentioned, at the moment we have every entity has a set of information that they only are using for themselves, and looking at it from a marketplace perspective, as we are going, we want to streamline all these different parties basically together that synchronize their services to deliver a better care. And in the long term, we will definitely see robots, we will see more technology, we evolve in this field. But I think medium term, we still need to overcome more hurdles in the field of the administration of the care itself.
So at the moment I can book a professional care at your marketplace. So do you think in the near future I can book robots at your marketplace?
I could definitely see us long term as one element in basically steering all these different services. And the robot, I would say, is only one part of it. I mean, if the robot can also prepare your food, okay, then let's go for that. But I think it will need one platform, or will need a platform in the middle that is basically in control of all these different parties. And that's, you know, definitely something we could see us being.
Thank you. We have heard in this afternoon a lot of buzzwords like artificial intelligence, big data, or streamlining of administration and processes. So can you give us a glance into the future where these buzzwords can improve care, like, let's say, big data? Is this a field which is also relevant for elderly care or just for health care?
I think we're still not at the stage where we're even collecting enough data. I think first of all we need all these devices that collect the data. Then we need to create entities that basically bring all this information together, and then use artificial intelligence to analyze this data and make assumptions from the findings, and then bring this wisdom back into the devices, and then we have I would say a circle where we have a smart home for elders.
Giuseppe, you're also collecting a huge amount of data, I assume. So what are you doing with this data? Are you learning, or is this a kind of big data topic?
We are using the data to see if the person is actually, if there is a decaying. And again, we have to be very careful with that. I can't stop highlighting the importance of taking a safe route towards management of personal data. So we have a huge opportunity in terms of improvement of services, but there is a huge threat. And to me, the grand challenge here, it's at the border of big data and ethics. I'll give you an example, a very practical example. This is a person that I know. The mother has got a developing, probably Alzheimer's disease, and the person, the mother of this friend of mine, doesn't want to go through a formal assessment with the doctor. So the children, the family, are trying to book an appointment with her, with the doctor, together, to explain the situation. She does all that she can to change the booking, go on her own, and of course pretending that she's fine. Now the point is, they could install a system, a technology, and monitor her behavior. This is both unethical and illegal. But at the same time, she needs probably that help. So I don't have the solution, but it's clear that we have a problem. And this is something that needs to be tackled very carefully. It's not a technological problem. Now we got to the point that from the technological point of view, I think we have quite a lot. The problem is social. It's again ethical. It's again finding the right mix to make sure that the person is aware. So the awareness of the person with regards to the power of the information that can be collected, without having this backfiring to the user itself. I don't have the solution right now, but I certainly feel that there is a problem, and there is probably a market opportunity if you look at that term.
Diana, do you want to add something? Because I also assume that your company is collecting a huge amount of data, and that your software is working. You have constantly improved your software. So, and you also told us that you're evaluating your service. So I think data is very important for you as well.
Let me. So when we talk about big data, as you mentioned, I mean, every single caregiver has to document his daily work routine, and we are collecting all this data, but no one is ever using it. It's just there for controlling reasons. So much effort just to make sure that no one can charge you or make you responsible for any incident. I haven't seen any other space in business, in healthcare or whatsoever, where data is that much collected without using it. And from our perspective, so get back to Lindera, we are very, how can I put it, very economic when it comes to data because of two reasons. One reason, as a startup, collecting data is kind of expensive when you think about your server entity. And the other reason is, as more data you generate, the more difficult it gets in terms of data security, privacy. And for us, for example, when we get a video, we immediately delete it. We only calculate the gate out of it, but it's just a really tiny little bit of data, and the rest we don't need it. And there we really work closely together with doctors over time that we know exactly what kind of data we need to get to our results. Because, I mean, big data is a nice buzzword, but to really find what are the right information you need to make your decisions is a totally different aspect. And I mean, even though we see a lot of things, we only make our decision based on a very few information, and that's where we really would like to find our way, our path, that we get the right information in a very economic and sensible way.
Also a very good point. In care, we are at the moment collecting a huge amount of data, but we do not use this data. Is this due to a lack of standardized interfaces, or why do you think we are not using this data our professional caregivers are collecting at the moment? And how can digital services improve or use this data that we can improve our healthcare system? Do you have any suggestions for that? Giuseppe, could you add something?
This is the grand challenge. There is a tendency to produce a lot of data. This is true, and somehow we are obsessed by sticking sensors and trying to get and squeeze as much as we can. I think this is a deviation of the way we look at the problem. In other words, we tend to solve the problem by increasing the kind of brute force approach, the amount of information we can gather, while the problem is to make sense out of those information. It's typical to see now a plethora of different technologies available for elderly people, each of them with their own cloud, with their own little service, with data stored God knows where. So data is there is too much. There is too much. The point is to probably get meaningful indicators, make them truly interoperable with the clinical side of it, and make sure that they can be useful throughout the life cycle of the person. In other words, and we get back to the clinical, non-clinical. In other words, now we have a clear cut. When you are at home, you are in the well-being domain. You measure your blood pressure. You measure your saturation. You measure whatever you want. At some point, so you switch into the clinical system because your clinical condition becomes serious. There is no bridge between these two words. It's like two different islands. Probably you have been collecting data for a long time. They're worth nothing, but they are there, and someone can make use of it, maybe abuse of these data. And at the same time, whoever needs the most, which is probably your doctor, cannot use it. We have a data paradox.
Okay, but if we would use the data which are available, we could, for example, predict who will fall in the near future, or who needs a professional care in the near future, in which countries we need more professional healthcare providers. So I think it's quite interesting to use the data. I would like to switch the topic, because we are talking about care, and the sessions before were about healthcare. I would like to ask you if care is a unique field of healthcare, and if yes, what makes care so unique, so special, that we need a special approach to digitalization?
One perspective is clearly economic. If I can help a doctor, I can simply calculate what does it cost 1 hour a doctor, and I can compare it to a caregiver. So we're talking about 11 euro per hour for a professional caregiver, and at least 10 times even more for a doctor. So when I get into this field with a digital solution, I mean, I first look at the doctor because the margins are higher. So if I find something there, I can easily help at that point. And as long as we treat elder care and care professional in that dimension, just based on this figure, I think we will never end up in a moment where we can really solve the problem there and find the link, the connections.
So you think that care is very unique, or elderly care is very unique, and we need a special approach to digitalization, or is it just one tiny part of the whole healthcare ecosystem?
I wouldn't say that it's that special or that separated from any other field. I mean, it's a huge asset that there's someone with a deep medical knowledge, know-how at the point of care every single day, tries 3 times a day with his really knowledge. I mean, we haven't got this situation in any other healthcare field. Nonetheless, we treat elder care through the economic dimension as really secondary, not secondary market, but in terms of valuation, how much we put into that. And there I see definitely that, I mean, only the lack of good labor, the lack of skilled labor makes this market more relevant. And it takes so much time to connect elder care to the rest of healthcare in terms of economics. It's simply, to my mind, it's very simple economics, because we underestimate the value of these professionals and how they can enhance and do prevention when we connect them to doctors and bridge the gap between these two worlds.
Giuseppe, do you want to add something?
I think if we imagine a vector that starts from the user and finishes with the operator, if we are into cure, that vector can be very long. There is an example of a company there that do remote monitoring. The doctor is probably on the other side of the planet. The user is on the other hemisphere. And yet you can deliver an excellent service with cure. If you are in care, you can do that, but you miss the human touch, which is an essential part of the game. So that's something that needs to be taken into account when delivering care service. The other bit of the equation is the balance between the specialization of the operators and the users. So the truth is that when the higher the level of cure, the more you're interfacing the human being with another human being, which is highly skilled and competent in a specific domain. If you're moving to a care, probably you are again entering a more human, passionate, empathical dimension, and probably with less qualified stuff. So it is completely different. So the problem at the heart of it might be shared to some extent, but the truth is that the condition around it are very much different. And I think this is the challenge. This is the way we need to adapt and change and make sure that we are truly caring services rather than curing services. This would be, to me, the key to interpret the difference.
And Tim?
I think I completely agree with both. I think you need to look at the structure of the market, and then you understand why digitalization has such a hard time being implemented. And I think that's because the market is very fragmented. You have, for example, 13,000 nursing services, for example, that are individual businesses, and then they have to take a decision of whether they implement a new software standard or something new. And I think they have a hard time enough at the moment to organize already their core activities, and thereby they don't have any free capacity to think of new solutions or more innovative ways. And therefore I think that's one factor that hinders basically the adaptation of new software solution or standards.
And if I may, I completely agree. I mean, if you look from the market's perspective, then take, for instance, traditional application supporting elderly people. At some point, you have what is called the buying decision. The buying decision changes with the conditions of the person. So if you're talking about completely autonomous people, it's them deciding to buy it. It's them who has to be convinced through the marketing message. Then the person becomes, unfortunately, partially dependent. At that point, the family kicks in. So again, the marketing message, the product has to be tuned to a way that you convince both. And your customers are very different. Because this time you're talking with the children. They are not millennia, but still they are very much different in terms of generation, communication, messages, and the senior. And then you move into full dependency. At that point, the buy-in decision, it's probably completely or almost completely to the family, but yet the person, the senior, has the main role. He or she is the person that needs to be cared of. So you cannot simply ignore. So you see, it's very complicated, and it's this human dimension that makes this market very difficult. And it's true that it's absolutely fragmented. So it's a market that is potentially enormous, but it's very hard to grasp for all this complexity, human mostly, that we are discussing, and it's being developed. It's in development, but it's not fully developed.
Okay, so I still wonder, because for me it seems as if care is much slower in the process of digitalization than healthcare, and I wonder what are the reasons for that. Do you have any ideas, or when during your daily work, what is hindering you in your daily work?
For me, elder care is the environment where we have seen absolutely grey paper-based processes, very complicated, very unhuman, and we copied them one-to-one on the screen. And for the last 10 years, this was the idea of digitalization in elder care. So we had processes that worked on paper, and I mean paper has got a lot of wonderful features. So it works kind of everywhere. I mean, when we are in the ambulant care environment in the middle of Brandenburg or on the tiniest farm whatsoever, paper is that thing where you can always rely on. And I mean, I'm traveling a lot through Germany, and we haven't found the perfect solutions for ambulant caregivers that really works. Plus, there's the screens. You can go to every single care service, to every single nursing home, look on the screen, and you still think you are in Eastern Germany in the middle of the 80s. It's just so far away from what we are, from a technological perspective, for what we are capable of here in Germany. And it's still, I mean, all the good features of the paper are gone, and only the ugly is still there on the screens.
Okay, but still the question is, why is care so much slower than healthcare? Tim, do you have any idea for the reasons, or why is that so?
Yeah, I agree with Diana, what she said in the beginning, that there are economic reasons towards that. If you simply don't have a huge budget, you don't have don't have to think so much how you want to spend it. So that's I think one very important aspect to consider in this field. Then on the other hand side, I think this field has other issues to solve yet. One is the staffing situation in this field, for example. So I think there are bigger issues, underlying issues that of course can be partially solved with software and solutions. But I think this entire field is in a process of changing so much that
Okay. And Giuseppe, what do you think are the major impediments fostering digital care solutions?
Cultural.
Sorry?
Cultural. It's a cultural problem. It's a cultural problem at the operators level. I think this is the single most important barrier. People involved have been used to paperwork. This is absolutely true. I completely buy. Sometimes you go to customer, you see that the process is entirely paper-based, and they think that digitalizing is like you digitalize a signature by scanning a PDF with your signature. That's not exactly the case. You need to reinvent the process. But that requires some knowledge and competences. And it's true that this has been a domain where you usually have little specialization. And this is probably slowing things down. On top of this, the other interface, the user is a senior that usually is not very technology keen. So while in cure you have doctors, you have mission critical often reasons to make sure that technology can bring to a better results. You don't have the same pressure in care. Now probably the single most important driver is going to be the money. We simply don't have the resources to keep doing it in the way we've been doing in the past few years. So probably, unfortunately, this will force things to change one way or another.
Okay, so we have cultural reasons and economic reasons, but still, I mean, I would say we have the same reasons in healthcare. And if we look into scientific literature or if we are looking for studies, we've seen such a lot of studies and future scenarios for healthcare, digital healthcare, and I've seen just, let's say, 2 or 3 studies about digital care. So if you don't look at the field of AL, so could you imagine why are we so much slower in care? I mean, you already named some reasons, but elderly care is, from a political perspective, it's so important, and nevertheless we are so slow. Are there any other reasons?
Well, I think we are stuck in this knowing-doing gap, that we know it's very important, but yet, are kind of stuck in really, approaching new solutions in this field, and also giving this field the budget that it needs in order to find the right solutions. So I think that's one issue.
Yeah. Another reason, when we say when we look at the elder care market, we have got the B2B market that we can target through the nursing homes. And then we have got, as you mentioned, the consumer market, where we need to address every single user. When we want to address every single user, we can't go simply to Google and throw our money there, or to YouTube, because that's not where we can find or where we can target this group with. When we go back to the nursing home, so to the business-to-business environment, we have seen, or following the fact that we only have seen the copy of paper-based processes onto the screen. So the result of this, so what's following is basically that when you go to someone in this field and say, well, I've got a digital solution, I've got a new software, I've got something that makes something easier, and it's technology, they immediately drop the phone. And for sure, because over years they have seen insurance company going there, well, you have got this new tool here, and with the consequence that you have got more time for protocols, more time for documentations. So they have really experienced over years and years and years that everything that's new that was supposed to be helpful is a new controlling theme, or is something that consumes even more time from the reason why they in the beginning choose the job to work with humans?
Okay.
And I'll buy completely, and I will also complement by saying that some of our customers, it is clear they have been overexposed to a number of solutions. So this is a market that it's suffering from its own fragmentation to an incredible extent, because it's full of small solutions. They are implementing a little bit of something for a few, probably nursing home only, with very little scalability. The result of this is that the buyer, we're talking about the B2B, have been bombed. And now they got to the saturation level. So this is something that needs to be also addressed properly.
Okay, thank you. Because we are running out of time, I would like to ask each of you to give us a short scenario how you would see digital care in the future. So can you give us a short description? What is going to happen within the next 10 years? Or what do you think is going to happen? Diana, would you like to start?
Yeah. To my mind, there are basically two things. One thing is we need to step back from the picture and have kind of an ethical contract in care, so that we as a society, as an aging society, know where we are heading in, and that it's totally clear that we want connections, we want this communicating family, this teamwork in care, and use new solutions to have it, but at the same point that we don't replace human interactions. I think we need a social elder care contract for this, really including the team, not just the caregivers, including the whole team. And the other thing to my mind, we are heading in is that we leave the way of control. So in Germany, we would say Ordnungsamt. We don't need a new control instance in care. So we need to really implement the idea of a connection. We need more a trip advisor than the new controlling entity in care. And that's a huge cultural shift where we really go back from a system of mistrust into a system of trust.
Okay, thank you. Giuseppe.
If I might tell the story, and if we look at the home market, so the B2C, the consumer market, I would see myself in a few years being an elderly person within an environment that is really smart, that requires absolutely no interaction. So it's the environment that completely understands what I need, where information, it's minimized and it's contextualized. This means that it's probably projected to me or brought back to me in a very easy way. That maybe there is some assistive technologies like robots and so on that are taking the chore out of me, but not the pleasure out of me. I would be helped to cook, if you see what I mean, and not being cooked constantly, because that takes a bit of pleasure away from you. So a more human, yet intelligent and effective interface. That's what the future should bring, and that's what the future, I hope, will bring to seniors.
Sounds very good for me.
Yeah, and in the end, it's important that we enable more and more people to stay at home in their environment which they like, and that they have still a rich, independent life that has a high quality, because I think that is not the reality today. The people that stay at home mostly live let's say, a boring or unconnected life. So I think one important step is that you're able to stay at home, you're independent, and that you have a rich experience still. So my future is, or the future picture that I have is that we kind of design experiences, living experience for the elders that are, let's say, no longer in full control of their lives, but they still have a rich life in which they have tasteful food, that where they are able to exchange themselves with others, and that's definitely the future that I envision, and that is enabled through technology.
Thank you very much. Just to summarize this, I'm very delighted because all of you said that digital solutions can never replace the human touch. And this is for me the future, that we still care for each other and there are not only robots who are caring for us. Thank you very much. If you have any questions to the speakers, come to our table and let's discuss. Thank you.